Today I'm answering the question, how can you lower blood pressure? The thing is, in order to treat hypertension, you definitely need to involve the kidneys so that they function properly and remove excess salts from the body. That way, blood pressure won't rise and the kidneys themselves won't contribute to increased pressure. But if a person already has high blood pressure right now and it's quite elevated, how can you lower your blood pressure right now at this very moment when it has spiked? At this point, it's impossible to just influence the kidneys because the effect will be delayed. In other words, there will be a result, but only in a couple of days. But we need to bring the blood pressure down here and now. This is a hypertensive crisis. The blood pressure has risen above 200. What needs to be done to instantly lower a person's blood pressure in this situation? Well, actually, friends, among all the medications that can be used to lower blood pressure, the most effective are antispasmodics, that is, vasodilators, which cause the blood vessels to widen. The dilation of the blood vessels may not last for a long time, but it will definitely inevitably lead to a decrease in blood pressure. Even if it's only for a short time, maybe just a few hours, this is a factor that allows you to lower blood pressure without causing harm to the heart or kidneys. So the answer is to use vasodilator medications, vasodilator drugs, vasotropic antispasmodics such as dibazole, papaverine, and even the same nofapotrentavir. But this is a safe way to lower blood pressure right now. The same goes for strong loop diuretics, diuretic medications like furosemide and Lasix. They can be used, but only once. This is to lower blood pressure for a person, not for regular use. Taking pills constantly is harmful to your health. Taking pills all the time is harmful. You end up damaging either your kidneys or your heart. But if you need to lower your blood pressure just once, you can use a strong diuretic or you can use vasodilator medications. In the end, you can even use poxonidine. This is a centrally acting drug. It works on the central part of the nervous system, activating the autonomic nervous system. But this drug will be less effective and may have delayed effects in terms of lowering blood pressure. In general, hypertension has its own treatment, and a hypertensive crisis also has its own treatment, in which case it is absolutely necessary to lower the blood pressure. This poses a risk to a person's life. That's why vasodilator medications are used, and that's why diuretics are used. And the main goal is to quickly and immediately bring down the blood pressure. However, other options are also possible. For example, simply lowering the legs into hot water can also lead to a decrease in blood pressure, which was very often used by paramedics in the past to quickly and immediately lower blood pressure. When you lower your legs into hot water, the blood vessels in your legs dilate, blood flows from the head to the legs, and blood pressure decreases. Although this method does not always guarantee a positive result and may sometimes have no effect at all. So that's the answer today to the question of what you need to do to immediately lower your blood pressure right now.